The word rhinoplasty, it's got two parts to it, rhino and plasty. Rhino refers to the nose, and plasty refers to change. That's what rhinoplasty is. It's changing the nose in a way that a patient wants to change it. What's most important is, what is my nose going to look like after this operation? We will actually take their photographs in the office and make changes to them on the computer, so we can actually show them with their own photos what we think we can achieve with their nose. It was a real step forward to make sure that the expectations are aligned with what we feel we can deliver. The way the operation actually works is we make some incisions that are very strategically placed so they're not easy to see. We actually will lift the skin up off of the nose and then change the shape of the bone by filing it, change the shape of the cartilage by making incisions in it, maybe removing some cartilage, maybe putting some elsewhere, straightening cartilage in an effort to reshape that skeleton, redrape the skin over the nose, and give it a different shape. The most common thing that people are seeking in a rhinoplasty is to change what we call the dorsum of the nose, which is basically this part. And the most common thing we'll see is someone says, I don't like the fact that I have a big hump, or what we would call a dorsal hump. What goes along with that commonly will be issues with the tip. So you might have seen people with a very rounded nasal tip, what we would call a bulbous or boxy tip. The operation itself takes anywhere from about 75 minutes to 3 hours, depending on what we're doing. The hardest part about a rhinoplasty for the recovery is that during that first week, you're going to have black eyes. That comes along with the operation, and you typically will have a splint on your nose to hold the bones in place. It's a really nice visit that first week when people come to get their splint off and their stitches out, because the black eyes have cleared, the splint comes off, they can see that they have a nice new nose. It's just a neat time to be with patients as they're going through this experience.